My name is Grayzel. I got a story to tell.
Oral cancer can steal from an individual the ability to express feelings and ideas articulately. It can rob one of the joy in food, a basic human need. Oral cancer can destroy lives. My name is Grayzel. At age 31, I developed a painful sore on the lateral border of my tongue. I never smoked. An oral surgeon told me if it bothered me so much, it could be removed. I followed that recommendation to resolve my discomfort. 2 weeks later, I received a phone call from the oral surgeon's receptionist. I was told my biopsy was negative. I didn't know it was being biopsied. I was assured I had nothing to worry about. I didn't know I needed to worry. I was unaware you could get cancer in your mouth. I should have been told my biopsy was negative for cancer. 2 years later, a painful sore returned directly over the biopsy site. For the next 9 months, I was bounced back and forth between my dentists and my oral surgeons. They prescribed rinses, gels. My molars were shaved down to prevent irritation. I wore a night guard. Nothing worked. I was desperate for an answer. Another biopsy was recommended. I was diagnosed with squamous cell carcinoma, stage 4. My head and neck pathologist determined the original biopsy from 2 years prior was misread by a general pathologist as hyperkeratosis, when in fact it was moderate dysplasia. I endured a partial glossectomy, a modified radical neck dissection, and a maximum dose of radiation. It is my obligation to share my story, to help others avoid a late discovery and diagnosis. If you don't want what happened to me to happen to your patients, do these 3 things. 1, educate. Use the words oral cancer screening. Tell your patients what you're looking for and the signs and symptoms of oral cancer. If you don't, who will? 2, follow up. My doctors said if it doesn't improve, come back. They should have said if it doesn't resolve completely, come back. Persistent lesions are usually dangerous and require a definitive diagnosis. 3, biopsy. You can only make an educated guess upon a visual examination. Rule out cancer first and foremost with a biopsy. Assure it has been reviewed by an oral pathologist. If you educate patients, follow up on suspicious symptoms, biopsy for a definitive diagnosis, you can spare a patient from the devastating effects of treatment for oral cancer. Screening is just as important as cleaning. If you could save 1 life in your entire career in dentistry by doing oral cancer screenings on all of your patients, wouldn't it be worth it?